Thanks for staying with us. The program is still Today with John and Helen, live on PlusTvAfrica. And now we have Dr. Uyai Usoro, medical doctor and a general health practitioner. We'll be exploring a topic that concerns many couples, but is often not openly discussed: erectile dysfunction. Hello and welcome, Dr. Usoro.
Thank you so much for having me.
Okay, and I thought this was only for men, but clearly I was wrong again. I look forward to learning so much from you, young lady doctor. Good to have you. Welcome.
Thank you so much.
So I start.
Okay, you start.
I start. Lady to lady. Let's start from the basic. Kindly explain briefly to us what erectile dysfunction is in simple terms.
Okay. Basically, erectile dysfunction is the consistent inability to either achieve erection, or sometimes you're able to achieve it, but you can't maintain said erection. Yeah, you can't sustain it throughout the duration of your sexual performance. And this is much more common than we think. But there are many undocumented cases due to the stigma that is associated with it. But let me dabble a little bit into the physiology of how erection comes about. So when you're stimulated as a man, the penis is a highly vascularized organ. So with neural stimulation, this causes increased blood flow into the penis. So it makes it hard, makes it rigid, makes it erect. And then this should last throughout the duration of sexual intercourse. But when there's a disruption in any of the mechanisms responsible for this usually results to erectile dysfunction.
You're making it sound like it's a machine of some sort. Yes, I agree, it may be a machine, for many. Yeah? But how common is erectile dysfunction? If you ask anybody on the road, men are always in self-denial.
They are, that's true.
I know. Meanwhile, they can't get it.
That is true. It's much more common, and there are so many undocumented cases because men, they hardly
undocumented.
Yes, they hardly share it. They hardly report to their physicians, even to their spouses. It's something they do not like to talk about, but it's much more common than we know. And like recent studies have shown that over 50% of males over the age of 40 to 45 years are experiencing or will likely experience erectile dysfunction. But this does not negate the fact that it also occurs in the younger population. So some studies show that about 8% of males between 20 to 29 experience erectile dysfunction.
20?
Yes. As young as 20 years old.
That is
wow.
That one is home trouble.
Okay, so if a young boy of 20 years can experience this, then it's time for us to find out what the common causes are.
Yes.
So what are the causes of erectile dysfunction that women and men should be aware of?
Yeah, for that, I would say the most common cause we are aware of is aging.
Aging?
Yes. It's expected over 40 years of age, some men may start to experience erectile dysfunction. It's kind of normal with the physiology of the body. As you grow older, there's certain decline in function. But it doesn't mean it cannot be managed. But it's something that you may likely experience. So aging is one of the commonest causes of erectile dysfunction.
Now the causes, and you said first was aging. Okay, you were going to the other causes.
Yes, after aging, we'll think of some pathologic medical conditions. When a man develops erectile dysfunction and he's able and willing to come to the hospital, it's vital that we assess for systemic conditions that could affect that. Number one, hypertension. Yes, this is a condition that can affect your vessels and impede blood flow into the penis, thereby resulting in erectile dysfunction. We have diabetes, we have cholesterol derangement, depression, which could affect your libido, has also been implicated in erectile dysfunction. There are also psychological causes, such as stress. Yes, stress from work, stress from marital conflicts, stress from interpersonal relationships,
trauma.
It could affect your libido, affect your performance. So you may experience some form of, it could be so severe that you cannot even achieve anything. So that could affect people. There is also performance anxiety. I'd like to speak on that, especially when this has happened before. Maybe it happened once. So you're anxious the next time. Is this going to happen again? So that is going to affect your psyche, obviously. So it may happen, you have erectile dysfunction again. Then trying to meet some unrealistic sexual expectations. Yeah, there are some things maybe we see in movies, adult movies. I'm going to say those are acting. You shouldn't set this as a standard for yourself. So you should try to do what works for you. Then some causes could just be purely psychogenic. There's no specific cause.
Okay.
There's no specific underlying cause to it. It just happens. Some medications, like medications for hypertension, medications for depression, some medications for ulcer can also cause erectile dysfunction. So it's vital that you speak with your physician, your prescribing physician, so they could be able to manage it, yes, and to switch if necessary. So that's
so doctor, it's blue pills to the rescue. We hear about blue pills.
It's a
just tell us a bit about
it's not the only form of management. I think that's a common misconception that erectile dysfunction, you use drugs like Viagra and so on, but it could help, but there are it's tailored according to your specific needs. For instance, if there is an underlying condition like hypertension or diabetes, you have to treat that before the pills. If you don't manage that, then it won't go. Even with the pills may just at that time work and then stop. But as the underlying disease progresses, it's going to worsen the situation. So you may have very severe cases of erectile dysfunction at that point. Smoking, excessive alcohol consumption, they've all been implicated in the causation of erectile dysfunction.
Okay.
Yeah.
Wow.
It's a good thing we're talking about this openly.
Yeah, it's important.
And there's usually a problem, discussing this. So how can women support their partners who maybe, how do we get to talk about it with our spouses? What's the lingo? What do we do?
Because you said earlier on that sometimes the men hide it from their wives. And
what's the communication like?
Open and honest communication.
Open and honest.
Honest communication. As a woman, I understand primarily it affects the men.
Yes.
But if you look at it on a deeper level, it spreads both amongst both sexes. As much as it affects the man, it affects the woman.
But our ego is there now.
Well, when it comes to long-term relationships, especially, sometimes you have to put ego aside and be able to speak up with your partner, discuss with your partner. The woman should be respectful about it, shouldn't be defensive, should not be aggressive, should not be obsessive. It's not something you should bring up every time, every issue. You could bring it up, address him, reassure him that you are here for him, that you understand that there's a problem and that you're always going to be here. You could encourage him on counseling, marriage counseling, sex therapy, and also seeking medical attention. Yeah, so it's, as a woman, it's also important at that point to also try to educate ourselves, because in knowing what it is, you're also able to care for your spouse, for your partner.
All right, so we're talking about this, and I'm thinking about where we are now.
Okay.
The things are really beautiful in this part of the world, and a lot of men are finding it difficult to play their normal role, being the head of the house and head of the family and the provider for the family. Could this also be a factor in this regard?
Yes, it could be, because at that point your stress levels are elevated, so you're trying to manage your immediate family, you're trying to manage your extended family, you're trying to manage your work life, manage your relationship with your friends, your colleagues. So these are all stressors, especially when the person doesn't find it so easy. The circumstances the person could be going through, relationship conflicts, divorce, whatever it is, it could elevate your stress levels, and this could affect libido, thereby predisposing to erectile dysfunction. Now, when a man or anyone is stressed, really, they could tend to deviate to certain lifestyle choices. Excessive alcohol consumption, smoking cigarettes. This, in turn, will affect your sexual performance, create anxiety. So it's like a vicious cycle. It's just reoccurring. It's like a vicious cycle. So at that point, it's important for the spouse to try to, mitigate it. Your stress, try to de-stress. Try to de-escalate whatever situation you're in. I understand it's not easy, really, with the whole...
I was going to say that.
No, I understand it's not easy, but
Yes.
I think there are some measures you can take personally. Identifying that there's a problem is the first step to it. And then working towards trying to, recover from whatever the issue is. If you want to go for counseling, you want to go for marriage counseling, you want to go for sex therapy, if you need to see a physician, you could exercises, meditate, yoga, whatever works for you and your spouse.
Those are regular things, Doctor. And I can talk to you, yes?
Yeah, you can.
We can talk.
Yes, you can.
That's what she said.
Okay, so those are regular things. Now there are certain myths.
Okay.
Can I call them myths that affect the man, or is it like just putting the blame on some? Sometimes they say, the kind of clothing, underwear you use or whatever, if you walk on the left side of the road, by the time you get home, you won't be able to. There are so many. Do you know of any other myths that we need to cancel from our
Yes.
from our mindset?
There are several myths that we need to address. The first one is age. It's not just a condition for older men.
Okay.
It could have, like I said, it could affect anyone.
So you can still be in the army at age 65, 70. You're still firing at all.
Yes, why not?
Okay.
Yes, why not?
That's good to hear.
Yes, why
it's
not?
encouraging.
Then some people think that it's just pills, like you said, but there are various forms of management,
Okay.
and it's always tailored to each person's specific
Peculiar.
needs. Yeah, so I talked about managing the underlying condition, talking about counseling. Sometimes all you need is counseling and sexual therapy, especially when it's psychological, when there's no underlying cause. Then there are newer therapies, like a shockwave therapy.
Shockwave.
Yes. It's a non-invasive procedure where you use pulse waves to generate energy. So this kind of, it's a restorative...
Misconception?
No, I'm trying to address the misconception.
Okay.
Where people say it's only pills that you can use. So there are different ways to manage erectile dysfunction, such as the shockwave therapy. So this kind of is a restorative therapy. So you're regenerating your vessels in the penis, making blood flow there adequate, making it erect and rigid. That's basically what we're trying to achieve when we're talking about erectile dysfunction.
Okay.
Yeah.
Wow. All right. So basically, the first doctor and we've been looking at reproductive health, if I can use that word, because if the woman is menopausal and she's no longer, in her period, the babies won't come, obviously. And if they're not aware of it and all that happens before and during, and then the man also has this issue and the woman does not know how to deal with it, one of the reasons people come together is to have babies, to have children, would have been a problem. So we're talking about cordial relationships. We're talking about the spouses, the husband and wife, to become one. You know, what happens to one, what affects one affects the other, and affects the entire well-being of the family. And so there's need for a lot of communication, openness, and trust, you know, and love, and all of it. As we get ready to round up.
You're sounding like a medical doctor.
So tell us, what are the ways that couples can maintain intimacy and connection during this season where the man is experiencing erectile dysfunction?
Yeah, well, I know or understand that sex is an integral part of any long-term relationship, but it is not the most important, especially when you're talking about long-term relationship. It's not the most important. There are other ways to connect with your significant other on a much deeper level, and it usually differs for everyone. So we have kisses, cuddles, hugs, leisure walks, acts of service, words of affirmation and encouragement. So these are ways you can connect with your spouse on a much more deeper level, while you know you're trying to mitigate an already existing problem.
And it helps to get this out of the way as quickly as possible.
It does.
Okay, John.
This is, I think this lesson was more for me than for
It's for both. It's for both, really.
And,
a final advice in like a minute?
Well, I'd say for the women, for any woman going through this, take it easy on yourself.
Your spouse.
Take it easy
on yourself
on
first.
Your spouse.
And your spouse.
Yes, it's temporary. There is a solution for that problem. So be able to seek help, and when you seek help, help will come to you.
Okay.
This is
so don't do it alone.
Don't do it alone.
Find, go get help.
Yes.
Talk to the people who should know, so they can guide you through it.
Dr. Usoro, are you sure you're not an inspirational speaker?
No, but the doctors are also meant to be there. Because by the time you walk into the world, you meet a doctor, all you need is
I'm sure that a lot of men out there now feel better having heard you speak. Thank you so much for all the insight, Dr. Usoro. A very important conversation, I must say.
And I'm very impressed. Very young doctor, and you have this deep insight about the subject that we have talked about
so
today.
Professional.
We appreciate your time.
Thank you so much.
Thank you. And on to our next guest, who will bring us back to a topic that could save your life and the lives of members of your families. It's about fire safety. Stay with us, and we'll be right back after the break.